Provincial healthcare systems in our country are changing before our eyes as they come up against the challenges of our aging populations, tighter budgets. One debate right now is over dual practice healthcare. So, what does that mean? It means allowing health professionals to work simultaneously in the public and private systems. Alberta government wants to be the first to try this. Premier Danielle Smith confirmed that in a video posted to social media last week.
This greatly benefits everyone on surgical wait lists, and here's how. Those who are able and want to can pay for the entire cost of their surgery or have it paid through employer insurance plans. They will be able to have their surgery performed in the off hours and come off the public wait list at no extra cost to taxpayers. That means everyone on the public wait list moves up in the queue so that they also get their publicly insured surgery done quicker than they otherwise would. And surgeons and other specialists remain in the public system but are happier because they get to perform more surgeries should they want to.
For more on how this could or would work, Rebecca Graff-McRae is with us. She's a specialist on public health with Parkland Institute, which is a non-partisan research center. Good morning.
Good morning. How are you?
I'm well. So I've had this conversation a number of times over the years. It usually ends with this is a slippery slope, and why would healthcare providers stay in the public system if they could make more in private? But this is something slightly different, what she's proposing. What specifically is the Premier hoping to do with this bill?
That part is a little bit up in the air because all that we know about this proposal, we have learned from leaked documents that were revealed in the Globe and Mail last week and from this advertorial from the Premier. But what we do know is that her intention is to establish a two-tiered healthcare system in Alberta by allowing this dual practice model, which means billing patients out of pocket for working in the private sector while billing the public purse while they're working in public hospitals and public ORs.
What is your sense of the support for this idea then? What's the reaction been in Alberta since it came out?
I think this is deeply divisive. Deeply divisive. Firstly, because this cuts to the very core of our healthcare system, which is centered around the idea that access is based on medical need and not on the ability to pay. So I think that should be concerning for every Canadian right now. But in Alberta also, this isn't the first time we've had a premier try to pitch these two-tiered system proposals. We've still trying to recover in our healthcare system from the attempts made by Ralph Klein 20 years ago. So in that sense, Albertans are deeply apprehensive about this. There is a core that has gathered around Smith and the UCP that have accepted her overt sort of villainization of public services. She's currently engaged in a number of lawsuits with our healthcare provider, Alberta Health Services, and some of its officials. But the frustration that Albertans feel about being able to access public health care right now is to large part due to the very policies that Smith and her predecessor, Premier Jason Kenney, have implemented that have undermined access to public health care.
Tell us how this works in other countries, because other countries have some dual practice, doctors working, as you said, simultaneously both in public and private systems. How does that look and where?
Sure. Some of the examples that often get pulled up are sort of closest comparators. The NHS, National Health Service in the UK, some comparisons to, Australia and New Zealand. One thing to remember is like every healthcare system is based on sort of unique legal and structural factors. We don't have an exact comparison. The NHS is fairly close. But right now, they're actually struggling to resuscitate their public healthcare system after making similar policy changes to allow this kind of third-party contracting and dual practice. Where it does work slightly better is where these systems have structured around including safeguards for the public system to prevent that sort of cannibalization. Some of those features have to include priority scheduling of doctors and healthcare staff to the public system and ensuring minimum staffing thresholds. They have to de-incentivize what we call cream skimming, which is taking the low complexity, high volume procedures into the private and leaving the really complex and urgent cases to the public system, and putting caps on the amount of extra billing that can be issued to patients to prevent profiteering off of it. Those safeguards are not in place here in Alberta. And in fact, the Smith government has been moving in the opposite direction.
I'm going to look at this very simplistically because that's what the average listener might be doing. I think, if you're just waking up and looking at this, you might be thinking across this country, our healthcare systems are broken. We're constantly doing stories, especially post-COVID, about the problems. We obviously want to have a good, strong public system. This is what people will look at this and they'll say, if someone can afford to pay for a private service and they're willing to do that and the doctors want to do it, and you can put safeguards in place so the public system isn't threatened by that, why not have better service on both sides of this? Even though you're creating that inequity around affordability. But if the access would be improved in the public system by nature of this having safeguards, so those people are still there and served, why not create a two-tier system? Why is that a concern for many?
Well, the first part is that it's incredibly difficult to ensure that access in the public system, even with some of these safeguards around, because it's predicated on having a sufficient healthcare workforce to run two systems. That's absolutely not the case in Alberta, and I don't think anywhere across Canada
Or in Manitoba,
that
yeah.
has. We are struggling with a staffing crisis across our healthcare systems in every province. And you only have one workforce. So when you create two systems, you don't clone that. So let's think this through. Like when you have an anesthetist or an anesthesiologist that's scheduled for shifts in this private surgical facility, that leaves their colleagues in the public system shorthanded. And at the same time, they're now trying to address emergency cases, more complex cases, and suddenly they do have fewer staff and fewer resources. That's where that negative feedback loop gets triggered. So the staff in the public system are now overloaded, they're burnt out, and they're more willing to then take additional shifts into that private system or to leave the profession entirely,
Altogether.
which is what we're seeing now.
Rebecca, thank you for your analysis. Appreciate your time on this today.
Thank you so much.